Hey guys, my name is Cassidy. I'm a fourth year, currently applying to neurology, and this is question 10 out of the 2024 free 120 for step one. Still in block one for this question as well. I know a lot of you, it's common practice to read the last line just to get a sense of the question. Totally fine. So he currently takes the maximum dose of omeprazole. Which of the following is the most appropriate initial action by the physician? So this is sort of a not really an ethics question, but just sort of a what should you do as a general provider type question. Not as much clinical knowledge based, but let's go ahead and dive in. So he's a 51-year-old male, 10-year history of GERD, and he has suspected Barrett esophagus. Um, he comes to your office because his omeprazole dose doesn't work around the Christmas holidays. He states that he prides himself on having a large appetite and holding his liquor during the holidays. So you already in your head, you should already start to be thinking about this sort of temporal association between the lack of efficacy of his omeprazole and the holidays with his large appetite and his ability to hold liquor. So that being said, let's just sort of walk through the answer choices here. I'm going to start from the bottom, and I think you know why. So the first is to switch the omeprazole to pantoprazole. Um, and I'll tell you, that's, not a bad choice necessarily, but I think there is a better choice, especially because you're not going to switch a medication unless you've given it a fair shot, essentially. And it sounds like, with the temporal association between his omeprazole not working and this sort of increased liquor and food consumption, it's not that the omeprazole isn't working. In fact, it sounds like it is working during parts of the year. So it's not really considered a failed trial, so much as a need for a change in behavior. So we can knock that out. Refer the patient to a gastroenterologist. That's probably something that needs to be done. But again, there is a better choice, especially because he has suspected Barrett esophagus. I mean, I would want him to see a gastroenterologist at some point. Sorry about that. But again, as you'll see in a minute, I think there's a better option. And it's not, this isn't something new, it sounds like. It sounds like, again, temporal association between the holidays and this inefficacy. So again, not the best choice here. Same can be said for ordering an upper endoscopy. It's possible that he needs one of those eventually, right? But um, again, this is not an acute issue. It's not like he's, having an active upper GI bleed or anything like that. Explain the hazards of untreated reflux in the presence of Barrett's esophagus. So again, first of all, he has suspected Barrett's. So I'm not saying he doesn't need an upper endoscopy. I'm not saying he doesn't need to see a gastroenterologist, but I'm not saying you don't need to explain the hazards of untreated reflux and if he does have Barrett's. Those are all great, well-rounded doctor things to do. But this is not the issue at hand here, right? The issue is that he's having this temporal association, and an issue caused by behavior. And so that leaves us with A, which is asking the patient how much he is eating and drinking during the holidays. Anytime you get these like sort of behavioral type questions, if there's an option to sort of make the patient dig further and dive into their behavior and sort of do a little bit of motivational interviewing, it's almost always the right answer. And some of these can get a little frustrating, especially on like U World after you do a few reps, because they're trying to make answer choices that are a little bit more subtle. This one's, fairly obvious, but if it's a little bit more subtle, just really try to think about whether or not it's going to ask the patient to do something less aggressive. Because at the end of the day, you want to be as least aggressive as possible, unless it's a really serious acute issue. And so in this case, his behavior is driving the issue. And so using motivational interviewing and sort of getting the patient to come forth with what's going on at home and how we can change behavior first rather than just piling on new medication or new therapy or doing further explorations with invasive procedures. That'll always be the right answer. Okay, so I hope that helped out, and good luck with the rest of your studying.